This is a preview of the Medical Acupuncture for Veterinarians course. I'm Dr. Narda Robinson, President and CEO of Curacor Integrative Medicine and Education Centers. Many of you have asked if you can get a preview of the online portion for the Medical Acupuncture for Veterinarians course. As you know, this is a course designed for veterinarians with either a single or dual track option. With the single track, you select either small animal and exotics or large animal and animals used for food and fiber. And you can also select both, and that's the dual track. So depending on which pathway you choose, you will be opened up to either 10 or 12 online modules with additional coursework that we've added since we originally created many of those modules in 2013. So when you get signed up, we like, if at all possible, for you to complete all of the online material, which is around 60 plus hours of recorded lectures and interactive exercises and assessments, so that once you get on site, then you are best prepared to participate in the activities that we have for you. And it's called a clinical intensive for a reason, and that's so that you get the optimal opportunities to develop your acupuncture techniques and skills with closely guided supervision. So that's the on-site portion, but here's the online portion, and it's offered through the Litmos learning system, which is a very straightforward, intuitive mechanism. And here, as a student, you see that I have lined up all different kinds of courses. Only some of them are medical acupuncture for veterinarians, because we do offer courses in medical acupuncture, medical massage, photomedicine, and botanical medicine, and then advances in many of those. So anyway, this is my course library. And where you see main, that's a human course, medical acupuncture and integrative neuromodulation. But we're going to be looking for the MAV, medical acupuncture for veterinarians. And you see here we have a clinical intensive preparation with webinar and videos. We have a business center where we have different things that you might use to get started, including a brochure that you can optimize to your own practice. But here is medical acupuncture for veterinarians, and I've been through it a number of times, but this is newly signed up on this version that I'm showing you here. So when you look at the module to begin with, we see medical acupuncture for veterinarians, module 1. So that's going to be a little course in its entirety, but there's going to be 10 or 12, as I said, depending on whether you're signed up for the single or dual track. So there's a little bit of an introduction here, but down below here, these are the modules that you go through. And for this
Welcome
course,
to Medical Acupuncture for Veterinarians, or MAV as we like to call it.
As you can see, we have recorded video here. Now, as I've gotten more and more into online course development and teaching and worked with a curriculum designer for an entire year, I've changed some of the formats for the programs that I offer to be more interactive and engaged, and have you search on the web for research materials or access various other people's videos on the web that you can link to through the course, or read articles, do other homework types of activities or quizzes, so that you're as engaged as possible and you can really integrate this material, make it your own, and then you can be an ambassador for scientific integrative medicine, because we want to cultivate leadership and not followers and this whole guru thing. So we've gotten away from that so long ago. So we want to empower you, give you the appropriate foundational knowledge, and then have you critically evaluate various materials so that you can then do the best job for your patients and make them well again. So this is just an introduction to the course. When I am done with that video, and let it play to the end because then you get credit for watching it, then we can press next module, and this is where I'm the topic is surveying the terrain. So I talk about different other practices and how medical acupuncture compares. And keep in mind, this is just the beginning of the first module. And as I said, you will have 10 to 12 modules to get through. So this one, we talk about the channels and points, and I'll just randomly pick somewhere on there. And it just goes through the comparative anatomy, acupuncture, as it translates from human to non-human, and just further along here, what I want to show is, just how I'm going through some of the channels and points, and we look at the dog, and we go through all the the main points that we've selected for the dog. We'll also talk about equine points and where they are and on the limbs. But I used in here many of the images from my human book, Interactive Medical Acupuncture Anatomy. And so you'll see some of those as well. So knowing that acupuncture began in the human realm and then was transposed to the veterinary realm, it is vitally important to understand how this came about, where the points are on the human, not that you'll be tested on those, but once you find, for example, large intestine 4 here, then we can talk about, okay, where should it be on the dog or cat? Is it a legitimate point to place on the horse? And so on. So really emphasizing independent critical analysis and intellectual curiosity. So that's essentially what we'll unfold for you. When we're done with that, or when we're leaving for a time, then we can go and say, okay, exit out of that, and I'll go back to my course library. Maybe for today I want to skip over to one of the other modules. We'd prefer you to go in order, but if you're reviewing, for example, here's the longest module, module 4, which is almost 12 hours in itself. And so this is where I really go deeply into the anatomy and physiology of the point. So I just randomly put here canine points, small intestine, and we'll talk about the treatment approaches. So what's the neurovascular and muscular relationship for a point? What is the innervation of it? Because acupuncture works primarily through neuromodulation and connective tissue effects. And then I'll show an image from my book and talk about the relevant nerve. And then we put it all together and say, okay, here's the anatomy, but what's the functional significance of this? How do I really make a difference for my patients using this knowledge? And that's where we talk about the relationship between structure and function. So if we have a needle and we're stimulating a point near a nerve, then once that nerve is excited, then we can think of all the different things that that nerve does and the connections that it makes. So some points will have just local effects, some will have regional effects and or local effects. Mostly they're all going to have local effects, but some actually have long loop reflex effects. For example, pericardium 6 here on the distal forearm. And that's where you can neuromodulate brainstem activity and treat nausea, treat epigastric distress. So we're really putting it all together, knowing the anatomy and then being able to predict physiologic changes as an outcome. And then finally, as we go through the course, one of the big emphases that we're going to place is on myofascial palpation. So with my background as an osteopathic physician and a veterinarian, I've come to recognize just the primacy of putting your hands on the patients gently, but with informed palpation, that you're going to feel the tissues, you're going to feel for myofascial restriction, and understand how whatever is going on with the patient, whether it's musculoskeletal, whether it's internal medical, whether it's neurological, that there is going to be some kind of soft tissue manifestation that will help you ascertain whether that diagnosis was accurate or not, and what kinds of interventions we can bring to bear for this treatment, whether it's neuromodulation by acupuncture, by photomedicine, by manual therapy, whether we need to work with the connective tissue somehow, locally, regionally, systemically, and so on. So it's really about how to be your best practitioner self and how to get as accurate a diagnosis as you can and treat your patients appropriately, correctly, and non-invasively. So I hope that provides some information on the online portal. Let's go on, and I'm going to exit out of this and actually go to one of the assessments. So this is one of the earlier assessments where it's just a self-quiz on what you've learned. So we'll just start over, and we can see the different multiple choices here for the exam. As I said, I have developed these courses further. So you'll see with the newer modules that I've updated that it's not going to just be multiple choice, but it may be just free text where I ask you a conceptual question and require you to draw in elements that you've learned so you can really get to a deeper level of understanding and I can know that you are there. So expect that as well, because I want you to really to know this stuff and be an advocate and not just get into that rote memorization and regurgitation. So That is our longest module. If we go back to course library, there are other things that we cover too. We cover laser therapy, we cover massage therapy, other ways that we can use related techniques to add to our acupuncture paradigm. And then I have other lecturers that come and help me for the large animal, that's 9 and 10, and then for the small animal exotics cases too. So, but everything's evolving. Different lecturers might come and go, but overall, we are looking to give you the best course experience possible and make this online learning fun and vibrant. So thank you, and I hope that helped you understand how this online portion works. See you at MAV.